Hello guys, how are you doing? Welcome to the YouTube channel HealthQ, the health awareness channel where our mission is to motivate you to look at the brighter side of the health. We are going to talk about some of the common sports related injuries that happen among the people. Although the people are very much passionate about the sports they are involved into, but they put them much at higher risk of developing certain kind of injuries. Sometimes injuries are not preventable, but it's good idea to have a general knowledge about it so that you don't get scared or panicked when you land up in an injury and is well informed and aware about what should be done about it. So today let's hear some of the common sports related injuries that is seen among athletes. So the first commonest injury that athletes or else sports related people develop is ankle sprain. Sprains are nothing but the injuries to the ligament. Sprains can happen to any of the joint, but ankle is one of the most commonest areas of damage, especially to the ankle ligament. The reason being, whenever we are involved in athletic activity, the foot is the area where the maximum load falls. This makes the ankle ligament more prone to develop wear and tear. Suddenly stretching of the ligament past their limits leads to ankle sprain or else strain. Although strains are not a major damage because it's just a stretch that has happened and can be managed very conservatively, sprains is meaning where there is tear of the tendon or else ligament, leading to more serious kind of problem. This might require conservative to surgical management depending on the severity of the problem. Second common sports related injury is called as groin pull. Adductor muscles are the muscles that are located in your inner thigh region and are responsible for your leg inward movement, especially when you are kicking a football or else you are trying to throw a ball or else when you are trying to hit with your tennis racket, the leg moves towards adduction, and at that time groin pull is very common. Sudden movement, twisting or else change in direction mostly leads to groin pull. The treatment depends on the severity of this pull, and mostly it can be managed by conservative method which is called as rise regime, which stands rest, ice, compression and elevation. Even if the pain is not managed with the help of this rise regime, sometimes there is requirement of help of electrotherapy modalities like ultrasound and TENS. The next common injury is hamstring strain. Hamstring is another group of muscle that lies in your posterior or else back thigh region. Hamstring muscles are responsible for your knee bending. At the same time, to an extent, your hip backward extension and to an extent slight abduction. Now, hamstring pull happens when one or more of the hamstring group of muscle gets pulled following an sport activity. Hamstring strain can range from a mild pain to a very severe pain. Mild pain is mostly managed with the rise regime to severe pain sometimes requires immobilization, external support and conservative methods, and extreme pain requires surgical intervention. The next injury is shin splint. Shin splint is also called as runner's knee, which means the pain is experienced in your front leg region. This is the area where the structures or else the fibers that are involved around the shin of your leg gets damaged following overuse or repeated activity. The inflammation of muscles, tendons, ligaments leads to shin splint and is the typical cause of overuse. Hence, the management of this problem is giving rest and reducing the intensity of the activity for a temporary period of time. The next common injury is ACL tear. ACL stands for anterior cruciate ligament. This is a tough or a taut ligament that lies inside your knee joint and is responsible for holding two knee bones that makes your knee joint tight close to each other. ACL injuries are very common in sports like football, cricket. It happens while doing some activities like sudden stopping while running, sudden change in direction, jumping, and sometimes landing on a surface forcefully following and fall. ACL injury again can be managed with the help of conservative management or else surgical management, totally depending on what level or else what extent of injury has happened. The next injury is patellofemoral syndrome. This is also called as chondromalacia patelli. This typically stands for pain that is experienced in your front side of knee region. Although it's common in athletes, it's equally common in general population or else people who are not involved in athletic activities. People who just start walking, brisk walking especially, in their regular routines can tend to develop this kind of pain. Mostly patellofemoral syndrome or else chondromalacia patelli develops following malalignment of the position of the kneecap bone in relation to other muscles and the joints surrounding the knee region. Overuse and doing strenuous activity repeatedly is one of the major cause for development of this problem. Patient typically experiences increase in pain in front of the knee joint, and sometimes even they will experience pain surrounding the knee joint. That could be swelling sometimes, and the pain typically increases while doing activities like squatting, climbing on the stairs or walking. Again, the management is conservative and requires a considerable amount of rest in order for the bones or else joint to recover back. The next injury is tennis elbow. Tennis elbow is nothing but an inflammation of the tendons or else the structure that joins your forearm muscles to the elbow region. The forearm muscles, which ends in your elbow region, tends to get damaged and inflamed following overuse. This is common in tennis players since there is a repeated activity of overhead pushing. In this movement, the extensor or else the muscles in your forearm region are continuously moving repeatedly, which leads to micro tears on the joint level, leading to inflammation and pain. Patient typically experiences severe pain as well as tenderness in the outer side of the elbow region, followed by slight swelling, which is very rare. Patient also experience the pain while doing some repeated movement of elbow and wrist. Again, the management varies based on the severity from conservative management, which involves rest, ice compression and elevation, and physiotherapy modalities, followed by strengthening exercise program. Steroid injection if the inflammation is more, and if the damage is too much, then surgical intervention is required. So friends, these were some of the common sports related injuries that people experience following indulgence into sports. I hope you found this information useful. If yes, make sure to like this video, share it with your friends and family members, and don't forget to subscribe to our channel. See you in another video. Bye bye.